Okay, so thank you guys for coming to our informational meeting about sexually transmitted diseases and practicing safe sex at college campuses like UNH. Before this, we had you take a survey, which was a series of questions about knowledge that you guys already had before coming. So I'm just going to read some of those questions and your answers. So the first one was, have you ever had unprotected sex? 6% said no, and 93% said yes. Have you ever had sex using a condom for protection? 6% said no, and 93% said yes. Which of the following statements best describes you? I am not currently sexually active because I am not currently in a relationship. I am not ready to have sex. It goes against my religion or beliefs. I am sexually active. So 25% said I am not currently in a relationship, and 6% said I am not ready to have sex, and 75% said I am sexually active. So do you feel pressured to become sexually active at times by your friends, roommates, or society as a whole? 25% said yes, and 75% said no. Would you say that you are well informed on safe sex practices, contraceptive alternatives, STI and risk factors, and where to get tested? 87% said yes, and 12% said no. Have you ever been STD tested? 75% said yes, and 25% said no. Would you have sex with someone without asking if they'd been tested first? 68% said yes, and 31% said no. And we asked, what do you think is the most common STD? 6% said gonorrhea, 93% said chlamydia, and no one said HIV. Are you more worried about getting pregnant or contracting an STD? 61% said getting pregnant, 38% said STD. So those are all of the questions we asked you. Thank you for participating in that. There are many STDs out there that women may or may not be aware of that are on college campuses today. Overall, 1 in 4 college women will have gotten an STD. So some of these include chlamydia, gonorrhea, HPV virus, hepatitis B, herpes, HIV, and more. So does anyone know the right answer to the question about which is the most common STD?
Chlamydia.
Good. So we're going to focus on chlamydia since it is the most prevalent STD. There's over 1 million reported cases each year in the U.S. The highest rate of infection is within women within the ages of 18 and 24, which is our age group. So that's why it's important that we are talking about this today. Transmission can be oral, vaginal, or anal intercourse. Symptoms start between 7 and 28 days, but mostly there are no symptoms. If symptoms do occur, there can be abnormal discharge, bleeding between periods, burning and pain when urinating, and frequent urination. It is important to find out if you have gotten an STD as soon as possible because STDs like chlamydia can have long-term problems for women. If left untreated, pelvic inflammatory disease can occur. This can cause infertility, problematic pregnancy, and chronic pain. So testing is really important. It should be done at least once a year if you are sexually active. Testing includes urine samples, blood samples, discharge swabs, and regular physical exams. UNH Health Services provides confidential STD testing right here on campus. You can make an appointment by calling or booking online. And here are some pamphlets that they will tell you more about their services. So you can pass these around.
And then here are some things that you should know before you start engaging in sexual behavior. You always want to use a condom. You want to avoid having sex under the influence of any alcohol or drugs. You want to create limits with your partner before having sex. You want to take your time and respect yourself. You want to talk about sexual history with your partner. You want to always use protection. And you want to remember that birth control only helps prevent pregnancy. It does not affect prevention or spreading of STDs. You want to get tested regularly, and you want your partner to get tested regularly as well. And you want to limit your number of sexual partners.
Okay. So abstinence is the only 100% guarantee of not getting or spreading an STD. But latex male condoms, when used constantly and correctly, can reduce the risk of transmission of STDs. Sex with a condom is not 100%. Certain STDs can still spread even when a condom is used, but using condoms will greatly reduce the risk. Okay, so I'm gonna say a sentence and you're gonna tell me if you think it's a myth or a fact. It is safer if I use 2 condoms.
Myth.
Correct. It actually increases the chance of the condom ripping. You don't need a condom for oral sex.
Myth.
Correct. Gonorrhea, chlamydia, and herpes are all passed this way. Most condoms are 99.6% effective.
Fact.
If you're on the pill, you're protecting you and your partner from STDs.
Myth.
Correct.
Now we're going to show you how to put a condom, and our friend Rachel from the audience is going to help volunteer to show us with a banana. So first things first, you're going to check the expiration date, and you're going to open the condom wrapper, and don't shred it, and use the easily tear edges, and do not use your teeth. You're going to determine which way it is rolled, so roll on your finger gently, and if it resists, it's not the right way that you want to put it on, and do not roll it past the first roll, because then it will reduce its efficiency. So you're going to make sure that the tip of the condom is up, and you're going to make sure that the penis is fully erect. You're going to pinch the entire reservoir at the tip of the condom shut, because it creates an air pocket, reducing the risk of breaking. So you're going to roll the condom on. And while doing this, you should be looking and feeling for any breakage or holes. And immediately after ejaculation, you're going to withdraw the penis, remove the condom, and dispose. Okay, so now we're just going to pass around some condoms and the banana so you guys can practice on your own. And you're more than welcome to take some of the condoms. We got them for free at Health Services, which is another resource that you guys can use to continue to practice in safe sex. And if you have any questions on how to use a condom, just let us know.
Now I'm going to ask you questions about what we just taught you. Can you tell me the importance of having protected sex?
To not get pregnant.
Or
Don't get
STDs.
Can anyone tell us a few tips to tell friends about practicing safe sex?
Don't do it when you're under the influence. Get
condom.
tested.
Just because you have birth control doesn't mean you're gonna not get STDs.
Can you tell us what the most common STD for women our age is?
Chlamydia.
Chlamydia.
What is the most effective form of protection?
Abstinence.
And if you aren't abstinent, what's the next most effective?
A condom.
Correct. If sexually active, how often should you be tested?
Once a
Once a
year.
year.
So thank you guys for coming. We really appreciate it. And hopefully this spreads some information about having safe sex.